You're watching CTOM TV. Knowledge is power.
Is tumor marker testing included in public health care?
Yeah, tumor marker testing.
Tumor marker testing is the question from Raj. Particularly, he's asking about the Canadian medical system.
Okay. So yeah, that's what the Canadian system does, is uses tumor markers.
So the fact that I'm asking you these questions tells me that I don't fully understand what you've just told us. So I probably have to watch and rewatch, but that might mean others don't quite understand.
Well, I think, we'll go over the definition again. So a tumor marker is a substance found in the tissue or blood or any other body fluid that is supposed to occur at a higher rate in tumors than it does in normal tissue.
Okay. So somehow we figured out through science that if there's more of a certain something in your blood, it probably means you have cancer. Is that why
it can?
Okay.
Not necessarily. You need to have a biopsy, and that's why none of these are conformational tumor markers.
I see. The ones that are up on this image here, right? Okay. Is that what you're referring to?
Mm-hmm.
Yes. Yeah. Okay. Okay. So if that's a tumor marker, then then I understand what you mean. There can be some genetic mutations, like the BRAF.
Well, they've included BRAF in this diagram, which is interesting. But we don't focus on these tumor markers, and we don't spend a lot of attention to them. We look at genetic because we're precision oncology. So, we will track the level of that mutation that is unique to a person's cancer because it's representative of their cancer.
So ultimately,
it's not some generalized protein that happens during inflammation or may or may not happen with the flu or something.
See. Okay, so sorry, it takes me a while with new things to figure out what the heck is going on.
Yeah,
so really what
complicated field.
Well, yes, thank you. So really what you're showing us here on the screen is what in standard care would be some of the markers that might lead them to diagnose these certain types of cancers.
Monitor.
You mean to keep an eye out?
Tumor markers are made for monitoring. They can be used in diagnosis, but because they're so ubiquitous and they occur in normal cells, you can't use them as a diagnostic tool.
Okay.
You can to a certain degree, but they have to be used in combination with a bunch of other things.
Okay.
So if you have a rising PSA, they're going to say you probably have cancer, but we're not going to know for sure until we do the Gleason test, is where they'll do, a bunch of different punch biopsies, and then they'll count the cancer cells in each punch biopsy. And then they'll say for sure you have rising PSA, which is a biological indicator. And then you also have, proof of tumors in your biopsies.
Right. And then we now are pretty certain there's cancer there.
Yes. But rising PSA can happen from, a variety of different reasons.
Okay.
Of course, it depends on how high that PSA is.
Right. So that's your concern with this structure, if anyone's thinking of this as a diagnostic tool.
Well, I think many doctors don't take these tests very seriously.
Because of what you're saying.
Yeah, I think most doctors have a lot of experience with these, and they kind of look at them and they'll say, well, now your CEA's rising, but, could go down, could go up. Let's look at it over time. Let's look at it over the next 8 months, And then if it's still high 8 months from now or 6 months from now, then maybe we'll get a scan. And then if we get a scan, then we can tell that, you have a tumor that's come back, and then we can come up with a treatment plan. But you can't really, in most cases, you can't use these as an indication as to whether the person should stop treatment or get treatment or not.
Okay.
So in many patients, their CEA will rise, but the doctors will keep them on the same treatment.
Okay, which is where something more precise, something like the precision oncology and the liquid biopsies is so much more important, because
the process that we just outlined, that is the ultimate solution. And this is what is changing cancer treatment, is the use of DNA that is unique to the patients, DNA markers, such as that BRAF V600E, that is indicative of tumor cells, not other processes.
Mhm.
We know that that mutation is only going to be present when the cancer is present.
Right. Unlike the CEA or those other things.
Exactly, which is
Right.
ubiquitous.
Yeah. So for those of you watching at home, if you have high PSA or high CEA or CA19-9 or all of those things, that doesn't necessarily mean that you have cancer
No,
yet.
not necessarily.
But the reason I'm saying that is because if you're experiencing some other symptoms and you're concerned that you might, there are some things that you can do to find out faster.
Yeah.
And while there might be a part of you that just doesn't want to know, or that's just too worried to go and take matters into your own hands and find out for sure. But if you are experiencing certain symptoms, in addition to those elevated numbers, then it really would be wise to go and have
Get
something
PET
like a PET CT
and
scan.
a biopsy
Mhm.
eventually. So, once again, they're used in conjunction with other, diagnostic tools. And that's because they're not that accurate.
Right. Yes.
So that's the problem with them.
Right. Okay.
Thank you for watching Cetome TV. Subscribe below and stay informed.